Hi everybody, my name is Virginia Lundy. I'm a registered clinical counselor at Angel Hands Integrative Center. In my last video, I talked about the symptoms of trauma, and today what I'm going to be doing is I'm going to be talking a little bit more about the kinds of situations can lead to trauma. How does one end up with trauma? The simplest way for me to be able to describe trauma to you would be to say that there are basically two types: big T trauma and little t trauma. Big T trauma is the type of trauma that most people will be familiar with. This is when a terrible event happens and it leads to some symptoms of trauma. This would be, for example, people going away to war, or getting into a major accident, or some physical attack like being mugged or something like that, or being a part of a natural disaster. There are things that people will look at and can pretty much agree that, yeah, that would be traumatic for a person. The other type of trauma is something that we refer to as little t trauma, and that's a little bit more personal, a little bit more individual in terms of the response that a person will give. Some examples of this might include a particularly devastating breakup, verbal or emotional abuse, being neglected as a child, or even just feeling neglected as a child or unloved, or childhood bullying. Just to keep it simple, I'm going to also include developmental trauma in the little t category, and developmental trauma would be something that occurs before we have the ability to really remember it as we remember things in adulthood. So things that happen before the age of 3, including prenatal trauma. And we also would include generational trauma in this category. So generational trauma would be something that happened to someone in your family in a previous generation, but it still has an impact on your ability to live a happy, fulfilling life currently. It's important to note then that just because you don't remember something doesn't mean that it doesn't have an effect on you still. In terms of treatment, most of the research would suggest that talking about trauma isn't all that effective. In fact, reviewing a traumatic event can actually re-trigger the trauma and further traumatize a person. So the recommended type of treatment, or one of the recommended types of treatment now, is called EMDR, and that stands for eye movement desensitization and reprocessing. I know, that's a big mouthful. Basically what it is a non-traditional type of therapy that doesn't use talk as its main modality and focus. In summary, trauma is a very complex issue. It can often go unnoticed and prevent people from living happy lives, having healthy relationships, being successful in their work environment. Basically, trauma can prevent you from being the best version of yourself that you can possibly be. So if you feel like you can identify with anything that we've reviewed in the last 2 videos, please reach out and get some support. Thanks everybody for watching. Until next time, take care of yourselves.